All right, everyone. Welcome to the public health workshop. My name is Dr. Jessica Liu. I'm a postdoctoral research fellow with the REACH lab at Stanford University. My mentor is Dr. Bonnie Halpern-Felsher. And today I will be presenting on public health as like a field and a career. But a little bit about what we're going to go over today. So first, we will talk about health kind of broadly, since a lot of us in this room are interested in health, science, medicine, etc. Then I'll talk a little bit about my journey and my story in public health. Then we'll have some activities and discussions, and then we'll end on sort of careers and how to get into a career in public health. So our goals for today are to define what public health is, understand the fundamentals of a public health approach, and also familiarize with next steps if you do want to take a career in public health. So I want to ask you all a question. How would you define the word health? Feel free, if you'd like to raise your hand and share what you think. You can also enter it into the chat. But if I could get just a couple people defining what they think health is. Okay, someone saying the well-being of a person, definitely. Other thoughts? Self-care, yes. Well-being related to physical, mental, and social well-being, preventative care. Wow, you all have this, like, this is great. Individuals' well-being, both physical and mental. So yes, you are capturing what health means. So what the WHO, or the World Health Organization, defines as health is a state of complete physical, mental, and social well-being that is not merely the absence of disease. So really what I want to focus on is that one key phrase. It's not merely the absence of disease. And that's really what public health is all about. And there's sort of like supplemental definition that the WHO has is that it also includes the enjoyment of the highest attainable standard of health and how that is the fundamental right of every human being without distinction of race, religion, political belief, economic, or social condition. So essentially that everyone should have the right to have the best health possible. And that's what the field of public health is trying to achieve. And why is this related to who I am and what I want to do? So, who am I? Again, I mentioned this at the beginning. I am a postdoctoral scholar, research fellow, whatever you want to call me. But I do research in public health, and I'm studying specifically adolescent substance use. But I won't be talking about that today. That can be another lecture. I do identify as a first generation student, and a fun fact about me is that I am a fitness instructor and I teach yoga. So a little bit about me. But what is it that got me here to talking to you all about why I'm so passionate about public health, why I chose a career in public health, and why I want you all to be exposed to this as well? So a little bit about my journey that I'm going to sort of walk you all through now. So I actually started as an undergraduate student at UC Berkeley. And while I was there, I was also, pre-health, pre-med, pre-whatever. But then I discovered public health as an undergrad, and I got to teach a really large public health class at UC Berkeley, and that really is what drew me into the field. But after graduating from Berkeley, I didn't know what I wanted to do, and I was really tired of being a student. So I took 2 years off to work in sales and recruiting, just, corporate, non-public health at all. And I think that's what made me really miss being in the field of public health, working towards that greater goal of achieving health for all. So I applied to master's programs and did get into the Yale School of Public Health, where I did my master's in public health. And while I was there, I discovered my passion for adolescent substance use prevention and specifically doing so in a research setting. So then I went off to pursue a PhD at Harvard School of Public Health. and continue to study adolescent substance use prevention. And now that I've graduated, I'm back here at Stanford in the Bay Area, where I like to think of as home more so than the East Coast. And I'm completing a postdoc here, also continuing to study adolescent substance use prevention and really learning how to do community engaged research. So that's a little bit about who I am and kind of what I want to share about my journey is this. So when I was a undergraduate student at UC Berkeley, I took a intro to public health class, and I had no idea what public health was. And I was sitting in this lecture hall with 700 other students. And there was this professor who was giving a research talk or just a talk in general about what is public health. And she showed this image of a river. And she was telling this story about how there is a situation in a town or a village where there was a river flowing through the village, and there were a bunch of babies floating down the river. Um, and babies, I don't think they can swim. But anyways, these babies that can't swim were unsafely floating down this river, and people in the village were really worried. So they were just pulling the babies, out of the river as they were floating down, trying to save the babies. But then one person was like, it's not stopping. The babies keep floating down the river. So that one person was like, let me go upstream and try to find out what's actually causing these babies to be floating down the river. And that person going upstream is the metaphor of what public health is. So public health is really about trying to not just address like what is happening downstream and sort of do the in the moment saving the lives, which is still a very important part of health and medicine. But the public health person is the one that's going upstream to figure out what it is that is causing all of this to begin and addressing the root cause. So that's public health in a river, in a village metaphor. So in a way, I kind of just describe this analogy of like, you can think of the downstream as sort of what we think of as, modern day medicine, people, kind of saving people's lives, like, after they've been diagnosed with some kind of disease or illness or after they're sick. But thinking of public health as addressing more of what's called social determinants of health. What is it, kind of about, the situation, the environment, you know, people's access to health care, social community environments, what about that is kind of more early on might be causing whatever it is that then is later on turns into some kind of disease, illness, whatnot, that then needs to be addressed by medicine, but addressing it earlier in the social determinants of health. So I have a quick activity that I would like us all to do, which is, can you think of a better and more appropriate metaphor for this upstream and downstream situation? Because honestly, I don't love that this metaphor includes, babies coming down a river. So I think that you all can maybe come up with better metaphors. So again, we talked about this a little bit, but social determinants of health are really important when thinking about public health and public health issues. So a lot of you talked about this in your metaphors, but what are some of these kind of more root causes of health issues? So as you can see, I'll go around the little social determinants of health circle here. But some of these things include healthcare access and quality, neighborhoods and built environments, social and community context, economic stability, as well as education access and quality. So these things are not like directly related to disease or, infection or health, like, healthcare problems, but these may lead or make certain people more or less likely to have or to experience health outcomes. And then on that same note, another really important theory when it comes to public health is also this idea of the socio-ecological model. And I know that's a mouthful, but the most important thing is that health is impacted across multiple levels of influence, and those levels are all here. So starting at the individual level, there are individual level factors that influence health, such as race, genetics, you know, and maternal education. Then you go to the interpersonal level, and things that might affect your health are household food security, or your family size, or your social interactions. And then the next layer beyond that is organizational. And so that's, what your workplace environment can be like, or your school environment. The next level beyond that is community. So that can be like, do you live in a rural or urban area, and how does that influence health? And then finally, you have the policy level. This is the highest level. So this is things like, development, urbanization, different policies and laws in place that help influence different attitudes and sort of big picture norms. Um, that's at the policy level. And what's important is that across all of these levels that you see here, they all work together to influence health. So that's kind of the key of this diagram. So these are two kind of big concepts like that you can think of when it comes to what influences health in a public health perspective. And public health, honestly, can include a lot. It's not just about, going upstream and looking for those social determinants of health. I think it can really mean a lot more than you think. So I'm going to share this video about a public health campaign, sticker campaign that actually is it's a little old. It's from when I was in undergrad. It was really popular, but I still want to share because I think it really captures the idea of what public health can be. So now it's your turn again. So I want you to think about what you see in your day-to-day life. And if you had this sticker, where would you put it? I do want to now transition to talking about careers in public health, because I know that's what a lot of you are here to understand is maybe if you are pursuing something that is public health or public health adjacent or like medical related, how might this all fit in? But sort of the next step, or what most people do to get into a career in public health, is they do a master's in public health, or an MPH. So this is a 2-year professional degree that you do after completing your undergraduate studies. So this is a form of graduate school that includes coursework. Most of the time you do some kind of research and or write a thesis in some programs. And then almost all programs require a summer internship where you gain work experience or research experience in public health. And what's great is that you can specialize in so many different things within public health so that you sort of can become a little bit of an expert in one area. So this is not across the board at all schools, but different schools tend to sort of have these departments or concentrations in public health. So they include community health, social and behavioral sciences. That's kind of where I've found my home during my MPH and PhD. There's epidemiology, biostatistics, which is the more quantitative methods, departments and fields. There's also health policy and health administration, which is more for people who are looking to maybe do, work in health administration in a hospital setting, or go off and do more policy type work. Those are sort of different areas you can specialize in, even within your master's in public health training. And when do you apply, or how do you apply to MPH programs? So usually you can apply right after graduating with your bachelor's degree, or you can work for a few years and then apply. That's what I did. I worked for 2 years, then I applied, but a lot of my classmates in my MPH program did come straight from undergrad. So that's definitely possible as well. And who can apply? So what I think is really great about public health and this degree is that there are no prerequisite courses. So it's not like medical school or other pre-health or like other fields where you have to take like biology and math and calculus and physics. Like there's no prerequisites. You can do whatever you want in undergrad and then decide, okay, I want to go into public health, and you can apply. You also don't really need extensive experience in specifically public health work experience because, as we just saw in the last video and couple of slides, really everything can be public health. So I would say, if you have experience that, again, is somewhat public health related, but not exactly public health related, that will still help, supplement your application when you're applying. And some programs do require the GRE, which is a standardized test. I hate standardized tests. I did not do that well on the GRE. So I think it's more of a formality if the school requires it. And a lot of programs have, especially after COVID, have removed that as a requirement to apply. So that's why I put a little question mark there. And generally, the application cycle is in the fall. So they open up the application like in August, and then they're due they're due at around December each year, with some schools that have rolling applications and some schools that even have deadlines beyond December, is what I've heard. So it's quite a range. And I think I have this on my next slide. Yes. And what's great is that there's sort of one centralized application program called SOFAS. So what's nice is you can kind of create one main application and then apply then individually to all the schools. And then you kind of just send the same materials that like you're kind of one main application, and you can send that off to multiple places. So the application components include, registering on the platform and filling out all the stuff about yourself. They require, I believe, 2 or 3 letters of recommendation. You write a personal statement. You upload a CV or a resume. Again, GRE, some of them require them, some of them don't. And then there is a application fee for each school that you apply to. So that is something to consider as well. And then as you're applying and deciding, where you might want to go, and this is across the field, not just in public health, but anytime you apply to school, I think it's always important to consider, the cost of the attending the program and how much tuition is going to be, and how that fits in with your budget and your finances. And also the location, because you will be spending 2 years at this program and at this school. So you want to be in a place that, if you want to be close to family, or, be in a place that's warm. I spent 6 years on the East Coast, being born and raised in California. That was quite the experience for me. So just keep in mind that location is something to consider as well. So what can you do with a career in public health after getting an MPH? So I did sort of a internal assessment of like, okay, what are my friends doing right now? And kind of put together this list here. So my friends from grad school, this is what they're all up to now. So a lot of them are doing research kind of like me. So that's one path. That's the path I took. You can go into consulting. Policy consulting, general consulting, health consulting. Like I know a lot of friends that went off to work at Deloitte, McKinsey, kind of those big, I can't even remember the names. Accenture, I think is one of them. Yeah, you can go off and work at a big consulting company. They do look for people with MPHs. You can also go off and do nonprofit work or work for a government organization like the CDC.
Is there a dance?
Yes.
Oh.
Yeah, no worries. Yeah, you can go off and work at a government organization like the CDC. You can work in hospital administration, for example, working at a large healthcare system like Kaiser. I have a couple of friends doing that. You can go into health education and become a community health educator and get certified to do that. I actually know a lot of people at Harvard actually move on to do like health tech or go into startups. And then a lot of people also go off and get another graduate degree like law school or medical school. This is something that's a little more official than just what my friends are doing, but I found this on the University of Michigan website. So this is their breakdown of like where their MPH graduates end up going. So almost a third do go on to some kind of like hospital or healthcare work. So probably med school, nursing school, PA school. About 22% go into academia. So that's kind of like what I'm doing, kind of a traditional research, professor, postdoc, that kind of stuff. About 11% go into government, 10% other industry or commercial firm, 10% go into nonprofit or NGO, almost 10% go into consulting, and then the rest kind of go into pharmaceutical, biotech, health departments, health insurance, or they're self-employed. So I think this maps on pretty well to like what I showed in my last list. Okay. And before I wrap up here, I do want to talk about kind of the kind of data analysis that happens in public health in some of these careers and paths, because I know that this is something that came up when I was advertising for this workshop. That some, and a lot of you also at the beginning expressed interest in is sort of the data science piece. So there's a lot that goes into the data science in public health and the research in public health. And I would say that there are two kind of main buckets of data analysis that happens in public health: qualitative and quantitative. Qualitative research is more sort of taking non-numerical data, so interviews, focus groups, pictures, other content, and doing an analysis on that. It can also include program evaluation or like engaging with the community and working with the community. That all sort of falls into qualitative research, implementation science, all of that stuff. And there is a lot of really rigorous public health theory and processes to conduct that kind of research. So just because it doesn't include the numbers doesn't mean it's not rigorous. And then you have the stuff that is on the quantitative side. So believe it or not, public health can be quite quantitative. I actually, in my MPH, when I was a master's student, focused more on the qualitative side because I thought that I wasn't good at numbers and still don't think I'm that great. I don't know. But then I went off to do my PhD and they were like, okay, if you want to get a doctorate in public health and be doing public health research, you need to learn the quantitative stuff. So I learned how to code in R software, but some other softwares that people might use in public health are SAS, SPSS. I forgot to include here Stata. And some people also use Python to do kind of more complex, like social network analyses. So there's a lot of coding that goes into public health research. There's a lot of epidemiology. So that's like sort of the study of, how disease is spreads and how the rates of disease and the numbers behind that. Some of that can be related to conducting regression models and doing longitudinal or multi-level analyses. That's what a lot of my work focuses on. And I don't do much work here, but this is also where the field is going, is using more sort of AI and machine learning to do sort of big data types of analyses. Because what public health is oftentimes done is like you'll get a huge data set from like thousands and thousands and thousands of participants across multiple years. And it's a lot. And what you can do with that is quite powerful. And That's kind of like what these quantitative methods will help with is that, taking these massive data sets and making meaning out of them and coming to conclusions that, again, support that upstream social determinants of health type work. So hopefully that gives you all a little bit of some insight of like, public health is not just putting stickers on, gyms and restaurant food menus and all of that. There's a lot of coding that goes into it. And I would say that I spend quite a bit of my time troubleshooting code and sitting in front of my computer, typing in R, not typing, but coding in R and doing data analyses as a big part of my day-to-day life. So with that, I'll sort of end on why I love my career in public health and why I, put on this workshop today. I really love that I feel like I'm making an impact at a population level versus an individual level. I love studying adolescent health. I think it's so important to be cultivating health at a young age, because again, that's again addressing the issues early on before they develop later on. My research is directly informing interventions and policy. I luckily had the opportunity to actually present my research in front of the Connecticut State Public Health Senate, and that was quite the experience. If you Google it, it exists on YouTube because it was like a public Senate meeting. But you can watch me get grilled for 45 minutes about my research, and it was quite the experience, but it felt so cool to see my work really be debated on, when deciding on policy. And of course, I get to work with passionate students like you all. Spending my Thursday evenings here, I wouldn't have wanted to spend it any other way. So I genuinely just have so much fun doing what I do, and I wake up every day so excited to start my day and continue forward in my journey in public health. So thank you. I'm happy to take questions now. All of my contact info and social media is here as well. So I'm happy to share this with you all. Please connect with me on Twitter or LinkedIn. Again, if I can help you in any way as you move forward in your own careers, I am more than happy to do so. But that concludes my official presentation. I have left us some time for questions and discussion, so I'll go ahead and open it up to you all now. But thank you all so much. It was hard at first, the transition. I lived in California my whole life. My whole family's here in California. So when I left to go to Yale, it was actually quite sad. Like I will never forget this, but I was like so excited. I was like, oh, I'm starting a new chapter of my life. Like I'm going to Yale. I'm so excited. I'm going to grad school. And my parents were with me. They helped me move across the country. And so I thanked them by taking them to dinner at this really nice steakhouse in New York City. And we were sitting there, and I don't know what came over me, but I just started crying my eyes out. And so we were sitting there eating this expensive steak, and I was just crying, crying, crying because I was like, oh my God, I'm like about to I just like literally uplifted my life in California and moved across the country. And I think it was just all hitting me in that moment. So it was an adjustment for me at first. It wasn't that cold in New Haven. It was really cold in Boston. I couldn't handle that, but I like adjusted to the cold weather, not bad. But I think, I enjoyed being there. I'm glad I got to kind of experience life outside of California, but I am not going back. So I hope that answers your question. Okay. I know we only have a couple of minutes left and I see a lot of questions. So let me just see what's in the chat really quick. Um, on the technical side of things for public health, are there any key skills you recommend we try practicing as an undergrad before? No, you don't need to do, like I said, there are no prerequisites to getting into an MPH program, and you will relearn everything that you need to learn once you get there. So enjoy undergrad, have fun, take the classes you want to take. And just focus on, figuring out what you're passionate about, and don't worry too much about building skills because you'll do that in grad school. All right, Selena. I never thought of myself as like a quantitative person, and but I had to learn it for the PhD for my during my PhD program. And I think for me, it was more like when I actually started applying what I was learning in the classroom to actual research projects that I was doing outside of the classroom. That's when the learning started to click and I started to like understand it, because when I was doing the homework assignments, it didn't mean anything to me and I didn't get it. But I just learned it for the sake of learning it. But like when I started actually applying it to like adolescent substance use, projects that I was working on outside, then it motivated me to learn more. And it's kind of cool. Like I can kind of say like, I can code, which I never thought I would be able to say. I hope that answers your question. Yeah, I mean, honestly, like this is a great question to end on is I just want to share that there's no limit to what you can do. And all of you can go to a school like Yale or Stanford. It's about just trying. Like, at least when I was applying for PhD programs, like I actually didn't originally think I was going to apply to Harvard, but one of my friends was like, "Why don't you just try?" And I was like, "They're not going to take me. Like, why would I do that?" But they're like, "You just do it." And so I did. I added them to my list of schools, and I believe it or not, I somehow got in. And it wasn't just by luck. It's because, I had a good application and I did my best. And I think that's kind of what I would share with you all is just keep doing the work you're doing, keep participating in programs like science small groups, continue to work hard, pursue what you're interested in, and it will lead you down a path. You might not get into Yale at the very beginning, but at some point in your journey, you will achieve kind of your goals. And just know that master's programs, especially, like it's not as like I didn't think I was going to get into Yale. I was working as like a sales recruiting person in a corporate office, and then somehow the Yale master's program took me. And I was like, okay, this is cool. So you never know what can happen. So I would just say, like, don't be afraid to apply for opportunities that might seem like they're out of reach, but in reality, they truly are something that is attainable for you because you all are here. So it means that you can do it.